Welcome to my channel BDS Bites. The topic for today is
pressure sore or bed sore.
Pressure sore. Definition. A pressure sore is a trophic ulcer caused by prolonged pressure leading to ischemia and necrosis of the tissues. So when the pressure cuts off the blood supply, it leads to ischemia and necrosis of the tissues. It is a non-healing deep punched out ulcer that may expose the underlying bone. These sores are common in the bedridden, in the diabetic, or in the comatose patients. So anytime a person stays in one position for too long, pressure sores can develop. Let's talk about what increases the risk of developing pressure, that is a predisposing factor. So we can use the mnemonic here, MAP, FES. Malnutrition. Malnutrition will obviously slow the wound healing and lowers the tissue tolerance. A stands for anemia, which reduces the oxygen delivery to the skin and soft tissues. P stands for prolonged immobilization or pressure, which will lead to reduced circulation. F stands for friction and foreign body. E stands for edema and excessive sweating, which makes the skin more fragile. S stands for sensory loss or septic skin, so the patient can't feel pain that damage is happening. So these factors tell you exactly who is at risk. Let's talk about the common sites. To remember the most common location, we are using the mnemonic O sits. So O stands for occiput, which is common in the comatose patient. H stands for heel, because heels constantly rest on the bed. So S stands for sacrum here, which is the most frequent site due to the prolonged supine position. T stands for trochanter, which is common in the side lining patients. S stands for scapula, and also S stands for side areas depending on line posture. So these are the pressure points you should always monitor. Now let's look at management. The mnemonic care bed here is for treatment. So it will give you a quick guide of what exactly it is. C here stands for change of position. Regularly you need to change the patient's position. A stands for antibiotics and nutrition to support the healing. R stands for ripple bed or air matrices to reduce the pressure points. E stands for excision and grafting. B stands for bed hygiene. E stands for edema control, also to evaluate the skin frequently. D stands for dressing and debridement and distribute the pressure to prevent further ulcers. So prevention is always better than cure. And that's your quick and simple guide to pressure sores. Complete with mnemonics you will never forget. If you found this useful, make sure to like, subscribe and share with your classmates.